Joel.
Oh, hi. How you doing?
Great, thank you so much.
All
I'm
right.
here to pick up my daughter's prescription.
Yes, I see that
Yeah.
you're picking up your asthma medication today.
Oh yeah, she
Yeah.
has asthma.
Uh-huh. Your doctor prescribed Advair Diskus, and it's used to treat symptoms of asthma.
Uh-huh.
Advair is a combination of two different types of medication, which
Uh-huh.
are fluticasone and salmeterol. So fluticasone is an inhaled corticosteroid and is used to help decrease symptoms.
Sorry, Dr. Joel, I have a concern.
Uh-huh.
I heard about corticosteroid and which has lots of side effects. So my daughter is 21 years old and I don't want her to be on a medication with these side effects. Is there anything that I can get, or how can I don't get this point of this medication.
Well, I understand your concern about the steroid. Both steroids are in the same family. However, with this medication that the doctor prescribed you, it will reduce inflammation in the lungs and the drug will stay locally and not go to the rest of your body. That may cause side effects that you're mostly concerned about. When someone has asthma, the lungs are hypersensitive to smallest amounts of allergens that are exposed and will cause further inflammation. Therefore, this drug will reduce the inflammation and will help with your daughter's breathing.
Okay. Dr. Joel, I still don't get that. When she takes the medication, it's in there. So you either take it or you don't take it. She's taking this medication, so how come you say I shouldn't be worried about it?
Again, I understand your concern, but just think about it like two fruits. So we have like a watermelon and a grape. So basically what you're going to be taking, your daughter's going to be taking, is just a small amount, like a grape, compared to an actual watermelon that she was taking.
Oh, I see what you're saying.
It's just a little amount.
Oh, okay. Okay, you mean that this much of like corticosteroid doesn't hurt?
Yeah, it's really small. Unless you eat a lot of grapes.
Okay, but this is not a lot. Okay,
Yeah.
got that.
All right, so now that I addressed your concern,
Yeah.
let me actually show you how to use this medication.
Oh, perfect.
So this is how it looks like outside of the actual foil packet. Okay, so this is how it's going to look when you open it. So don't open it unless you're ready to use it. Okay, so once you open it, this is how it's going to look like. As you can see over here, it says pouch open. So whenever you actually open this pouch and pull it out, you're going to write the date, whatever it is today, or whenever you open it up, okay? And then you're going to actually add 30 days to it, so then it's only 30 days. Just
So
put
it's
that
a
on
month's
there. Yes, a
supply,
month's
okay.
supply, All right, so how to use this is actually you hold this medication with your left hand here, and you're going to keep it level to your face. On the thumb grip, you're going to, or for your daughter, just show her this. And then put the thumb grip here, and you're going to open it until the mouthpiece shows. So it's going to be facing toward you.
So mouth goes here.
Yes, not anywhere else. Okay, so then this is the lever right here, so you're actually going to push this until you hear a click, just like that. And you're going to see this right here. This is the dose counter.
This says 30.
Yes,
right?
this is a demo.
Oh, okay.
Yeah.
Oh,
Okay, so but yeah, the real one's actually going to say 60.
60,
Yes.
okay. Yeah, so you said it's a month supply, 60, one puff.
Yes.
Okay.
So you're going to take this one puff twice a day, usually one in the morning and one at night. Usually 12 hours apart to get coverage throughout the day.
Okay.
Okay.
I understand.
Yeah. So every time you click it, that number is going to keep going down to let you know how much doses you have left.
Okay.
And usually when it gets around 5 or less, the actual number is going to be red. So it's going to let you know that it's actually time for you to get refilled. Okay.
Sure.
All right. So once you have it fully open, and you click it, that means it's ready to be used. So what you have to do is actually exhale, or your daughter has to exhale completely all the way out, and don't exhale out in front of this. So deep exhale, and as soon as you're ready, you're going to put the mouthpiece into your mouth and just basically inhale deeply and quickly, and then and once you're done, pull it out and hold your breath, or tell her to hold her breath for 10 seconds or as long as she can actually be comfortable holding her breath.
Oh, okay.
And
okay,
yeah.
Inhale and hold it for max 10 seconds.
Yeah, if 10 seconds or as long as she can.
Okay.
Okay. And once she's done, just have her close the actual medication, and pretty much you're done. And after you're done, make sure that she actually washes her mouth thoroughly with water, and don't swallow any of that, and just actually rinse and then spit out.
And what's the reason that she needs to wash and rinse her mouth?
We're gonna rinse her mouth after the use of this medication to prevent oral thrush, which basically is a fungal infection that can grow.
Oh,
so when you actually wash your mouth, it prevents that.
Oh, to get the medication.
Yeah, you don't want it
Okay.
stuck in.
Okay, good to know.
Let me also talk about missed doses too. So
yeah, it happens.
yeah, because it
I'm
happens.
sure.
You know, everyone
Yeah.
forgets. You know,
Okay.
like birth control and stuff.
Mhm.
So basically, if you do miss a dose, you want to actually take the doses or take the dose as soon as she remembers it. Okay, but if the time gets near the actual next scheduled dose, then just skip it and go through the scheduled dose and try not to miss any more from there.
And 2 puffs at that time?
No,
or just
1 puff.
One
This is
puff.
1 puff. So you
Oh.
never want a double dose.
Oh,
Yeah,
okay.
never do that.
Good, good.
Okay?
Mhm.
And for storage, once you're done, just keep this in a cool, dry place, room
Okay, sure.
temperatures,
Okay.
fine.
Mhm.
Keep it away from children.
Mhm.
Well, except your daughter, because she's the one who's using it.
Yeah, okay.
Yeah, and then throw this away safely after a month of use. So when you see that date, basically it's expired, just throw it away. Or if it's at 0, then toss it away also.
Okay,
Okay?
sure.
All right, so let me go through some common side effects that can occur using this medication.
Okay.
Oh, for your daughter.
Mhm.
Okay, so some common ones are upper respiratory tract infection, throat irritation, hoarseness and voice changes can happen, so she can probably sound like a man for a second.
Oh.
Bronchitis, cough, headache, nausea, and vomiting common ones, and of course oral thrush, that's the reason
Oh,
why
the one you told
yeah,
me.
so you want to
Okay.
rinse to prevent that.
Good to
Okay.
know, okay.
All right, so salmeterol, which is one of the actual medications in this discus.
Yeah, totally.
Okay, yeah. So this is a very, 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 that's what I heard, very rare side effect that can happen, but it's an increased risk of death when when continued use of this medication. But it's nothing for you to be too concerned about. It's very rare.
Okay, sure.
If I didn't say rare enough. Okay, and you don't want to use this Advair with any other medications that are containing that same medication for any reason. So you're going to be too much of that one.
Oh, I see. Okay.
And don't you, if your daughter is allergic to any milk proteins, she can't use this. Is she?
Oh, she's
allergic?
not.
She's not. That's
Okay,
good.
yeah.
Okay, and of course, call your healthcare provider if any breathing problems worsen over time while using this medication.
Okay, sure.
Okay. This medication will work about 30 minutes after the initial dose, and the maximum benefits may not be seen for at least 2 to 4 weeks. So, and each patient will respond differently, so she can respond either quicker or maybe later.
Okay.
And make sure that make sure that she's actually taking this Advair to keep her asthma well controlled. Otherwise, it may worsen the symptoms. So just make sure that she's actually taking this.
Okay.
And lastly, it is very important to follow up with your primary care provider within 2 to 6 weeks after taking this medication, and basically your provider will reevaluate the asthma of your daughter and maybe adjust therapy and see where she's at from there. Okay.
Sure.
Do you have any questions or concerns you want to address?
No, you told me how to take this medication, how to use this device, miss dose, storage, rinsing thing, very important. Dr. Joel, if my daughter have any question, can she call you? Because today she couldn't come to pick up the medication. That's why I'm here.
Definitely, yeah. She can call the pharmacy anytime. She can speak with me directly, or she can contact her doctor if she has any concerns or anything.
Okay, yeah, because it's a device. I don't want her to use it incorrectly. So if she has any questions, she can call you. Perfect.
Okay.
Thank you so much,
Oh,
Dr.
not a problem.
Joel.
Thank you for going to 2-puff pharmacy, and make sure that she only takes 1 puff though, twice a day.
Twice a day.
Yeah.
Sure. Thank you so much.
All right.
Bye, 2-puff pharmacy. This much of corticosteroid doesn't hurt.
Yeah, it's really small. Unless you eat a lot of grapes.
Okay, but this is not a lot. Okay,
Yeah.
got that. Okay, thank you so much.
Yeah.
Okay.
Medications that contain that same salmeterol.
Okay.
Okay. So that's for
Thank
any.
you guys for bringing that to my attention. Now I can monitor her. Just did you wash your hand? Yeah. Wash your.
All right. So let me go. Damn.
Or if she has any questions,
She can definitely call someone else.
did she call you?